Yes, cervical cancer is one of the leading causes of cancers in women. So far, we can say we lose almost 2,500 women in a year from cervical cancer.
Every being that is feminine is eligible to take the vaccine. And I can also say even our male counterparts, our brothers, they are eligible to take the vaccine.
Okay, I had a best friend, my classmate in high school. She suffered from cervical cancer, and it was the last stage, so there is nothing we can do about it.
And if you allow me to digress, we know what the COVID vaccines, the role they played during the COVID pandemic. If we went for the vaccine, maybe still down, we'll be still in the lockdown.
To the parents out there, I would say I would advise them to take their children. It's painless and it is cost-free, and prevention is better than cure. Cancer is cancer, and cancer has no mercy. So it's best to be safe than sorry,
All women from all walks of life are at a potential risk of developing cervical cancer at some point in their lives. Cervical cancer stands at the fourth common cancer affecting women worldwide. In 2020, there are over 600,000 new cases reported and over 340,000 deaths. In Kenya, there are about 5,000 new cases every year and approximately 3,000 women die from the cancer annually.
Yes, cervical cancer is one of the leading causes of cancers in women. Of course, the leading is the cancer of the breast, but the cervical cancer is leading in terms of causing mortality. Most of the deaths that occur from women with cancer are mainly attributed to cervical cancer. So far, we can say we lose almost 2,500 women in a year from cervical cancer.
The Human Papilloma Virus, otherwise known as HPV, is the leading cause of anogenital cancers. The HPV vaccine provides protection against the two strains that cause cervical cancer, strain 16 and strain 18.
Right now in Kenya, we have, of course, the Gardasil. Gardasil covers almost 4 types of HPV. That is HPV 16 and 18, and then 9 and 11. I think it's important to know that 90% of CS cervix is caused by HPV virus. And this HPV virus is sexually transmitted.
Vaccination is one of the principal strategies of combating infectious diseases all around the world. The HPV vaccine has been seen as effective, especially when administered to children before they make their sexual debut.
So currently the HPV vaccine is available. It's recommended for women, not women, rather for girls, and girls below 15 years.
In Kenya, the HPV vaccination was routinely introduced in late 2019, but the uptake has been low countrywide.
Every being that is feminine is eligible to take the vaccine. And I can also say even our male counterparts, our brothers, they are eligible to take the vaccine. Let me say that the campaign that was rolled out 2 years ago in Kenya, it targeted the girls at the age of 10. This is a new age bracket. Initially, we know that vaccines are given to children, newborns, between the age of 1 and 5. But now this is a new age group that has been targeted, girls age 10 years. So getting a girl of 10 years to have a vaccine of HPV, it's something new.
The WHO coined the 90-70-90 strategy to help combat the cervical cancer menace.
Because there is a WHO plan to eradicate cervical cancer. We are saying by the year 2030, and we are still hoping so. There is that they call it 90-70-90, where they are aiming at, by that year, they'll have 90% of adolescent girls, that is below 15 years, have been vaccinated, and 70% of women below 35 years have been screened for cervical cancer. And out of the 70% women who have been screened for cervical cancer, 90% of them should be treated for any premalignant lesion.
Since the HPV vaccine was rolled out in Kenya in the past 2 years ago, when the former CS of Health, she rolled out a campaign of having a target of 800,000 young girls, that is at the age of 10, to be vaccinated on HPV. It brought awareness on most people, on the women, and the importance of having this HPV vaccine amongst us, and it also created an awareness on having the importance of this vaccine with us women in preventing cervical cancer, and also making sure that ladies and young girls who are growing up, they know what it is and they know why it is important to have it at an early age in order to bring prevention of cervical cancer at a later stage in life. Yeah.
There was need for capacity building to see a smooth and successful introduction of the vaccine, and this called for teachers, volunteers, and health professionals to step in.
That is why the system was now rolled such that there's a collaboration with the Ministry of Health and the Ministry of Education, so that the girls in school, once in a classroom setup or in a school setup, it is easy to make them understand this, why it's important.
One of the main challenges affecting the vaccine distribution and uptake is awareness. A lot of girls in Kenya have no clue of the presence of the vaccine and have never heard about it. This contributes largely to the refusal of the vaccine.
My name is Joanne Joy, a student at Kenyatta University.
My name is Sylvia. I'm a barista.
No, I've never heard of that vaccine.
Not really.
I cannot be willing to take something that I do not know about.
I cannot take the vaccine since I don't know about it.
First of all, I said I cannot be able to take something that I do not know about. And the reason why I do not know about it is because no one has ever told me about it at any time.
I've never heard about it. I cannot consider taking the vaccine before I know about it.
You may find that there's a population of the women who know what it is. We can say that some are learned about it, but there's the other part of the population that is not aware about this. It's not something that we can sideline. So there's need of creating this information amongst the people in the lower cadre of life, the lowest level of life. And in this we can say maybe for those who have no education background with them, they may not understand what we are talking about when we say HPV.
Knowledge gap is also a main challenge affecting the uptake. There are girls who are aware of the vaccine presence in the country but still won't take it because of the insufficient knowledge they have surrounding the vaccine.
My name is Grace Nganga. I'm a business woman, 24 years old.
So I am Branka Melvin. I am a designer.
Yes, I have.
Yes, I have.
I know, personally feel like it's a prevention against cancer, most probably, with my knowledge, not much about it. Yeah. No?
No.
Because I feel I don't have enough knowledge about the vaccine, so I don't think I am educated enough about the vaccine.
Probably afraid. Like, it's something I've never tried. So, need the same na COVID vaccine. Like, I'm just afraid of taking vaccines.
Of course, why not?
The fear of the unknown is also taking a toll on some girls and women across the country. Many won't take the vaccine because of the risk factor. The question of safety and the possible side effects that it may have on the body are lingering on the minds of many.
It could have like some negative complications on my body since I'm not aware of it. And if it has negative complications on my body, meaning that is another health effect that will come with an extra cost of treating it.
Maybe I don't know about what they called, the side effects or something like that. And how sure am I it's a prevention, it's a drug for prevention.
Religion is one of the biggest challenges to the vaccination program. Since the introduction of the HPV vaccine, the Catholic Church stood a firm ground at protesting the vaccination.
Of course, also there are a lot of controversy. coming from religious sectors or other sectors who think people should be vaccinated. They call them anti-vaxxers.
The group commented that allowing young girls to receive the vaccine that prevents HPV, which in this case is sexually transmitted, was likened to opening doors for them to engage in premarital sex that the Christian doctrine condemns.
And you may even have that the people who are in the religion of Catholics, you may find that they don't easily take it because for them it's like, okay, this is a go-ahead for me to continue having my lifestyle as usual. No, not at all. It should not be so. This thing is to prevent the risk of contracting human papilloma virus. We are preventing, or if not preventing, we are reducing the risk. The risk here is what we are trying to alleviate. Yeah.
Misinformation has played a big part in lowering the HPV vaccine uptake. This has also made it difficult for the health fraternity to hit their targets.
Others believe that it will actually cause the cancer itself, but it's not so. Because this is a preventive measure we are putting in place. So the myth that is going around it, that it's going to bring more issues, more complications, it's going to make an individual be prone to the cancer itself, no.
Of course, we have had some religious quotas saying it has a family planning element, it causes people to be barren, and people are saying because HPV is sexually transmitted, why not promote people from having so-called reckless sexual encounters? But again, I mean, they're not being realistic. In the world we live today, I mean, a lot of things have changed.
Communication gaps between health personnel could also contribute to the low awareness or uptake of the vaccine in overall.
That's a good question. Of course, I can't say there are no gaps at all. But what I think needs to be emphasized is the people administering the vaccine should know the vaccine very well. Because as, I mean, all human beings are very quite inquisitive to find out the side effects, the efficacy. I mean, is it a long-term protection? So what I'll emphasize is that any health workers dealing with the vaccination, I mean, they should be up to date with the current information about the vaccine, the side effects, the pros, the cons, so that when a lady or a person comes seeking for those services, they get the adequate information. Because when people don't get adequate information, full information, then it creates rooms for those misinformation and misperceptions and rumors, so to speak.
Health resources have also been in the spotlight when it comes to the distribution of the vaccine. Several people from some parts of the country, especially the rural areas, have not received the vaccine owing to the limited resources.
The resources are limited. Maybe along the pipeline, it may not reach the end user as it's expected to be. Because once they are released from, let's KEMSA, and they're supposed to reach the consumer of this good, in between you may find that they reached at one point, the distribution stopped. So you find that there's a lot of issues that come about to the distribution, either the resources, the personnel who are supposed to administer this vaccine to the end user, the supporting system in place. In between, you may find there's a lot of corruption with the funds that are supposed to help in the full delivery of this vaccine to the end user. So there's a lot of accountability that needs to come in place when we are focusing on the factor of the distribution of this vaccine to the end user. Yeah. Okay, we may have barriers, especially barriers in making the information reach the consumer. Either the information is not well communicated, the members of the society, the women in the society, they are not well educated on the importance of this.
Most people have got preferences when it comes to taking a vaccine. Some women have expressed a strong preference for a vaccine that requires one dose. Some have not taken the vaccine because of the fear of the high cost. Since the HPV requires up to 3 doses, many find it difficult to keep up with the follow-ups.
Yeah, of course. I mean, they are given 3 doses, that is 0 to 6. After 0 months, then after 2 months, and after 6 months. And a shot can cost maybe 3,000, roughly. So imagine 3,000 times 3, that is 9,000. 9,000 for our low-income country is not peanuts. Is going to have an impact on the family budget. And that's why you find out the government has come in strongly and with other stakeholders to subsidize it or make it available. To be honest, as much as they say it is there in the public facilities, personally I haven't come across where I've found one. Maybe you'll go and find out, but if you go to the government portals or public health portals, it will be clearly said that it is available in some facilities. But I know in private settings, you can easily get it.
Where we are right now, I can give credit because the vaccines are available at any health center. So any health center that is, especially the public facilities, the public hospital facilities, they have the vaccine with them and it is freely given. So without any charge, any girl can walk into the facility and get it.
Some parents have taken the challenge and taken their children for the vaccination amidst all the dust.
My name is Radia Ali Noor. I am a mother of 2. I am a businesswoman and also I am a professional makeup artist. Okay, the HPV vaccine, there is a day I got a text message. Sometimes, you get a text message from, I think, is it WHO or the government? Sometimes they share information. And I used to take, my daughter has a condition with her throat, so I take her to the clinic. And then the nurse suggested that she should take the vaccine for cervical cancer. Okay, I had a best friend, my classmate in high school. She suffered from cervical cancer. It was very, very bad. Yeah, and it was just not okay to see someone who is close to you, someone who is, happy and all that, suffering from something that, and it was the last stage, so there is nothing we can do about it. Yeah, I did feel safe because, because I trust the government, because, when it comes to health, the government of Kenya is trying very much. It's really trying, and cancer is not a joke. It's not like flu or something else. Cancer is cancer. Yeah, and cancer has no mercy. So it's best to be safe than sorry,
The one question most people are asking is where they will get the vaccine from.
Okay, I got the vaccine from a clinic here in Donholm, Caltex, and it was cost-free. Actually, it was pain-free, it was nothing. I just had to convince my daughter.
Mainly you find it in the level 5 and 6 hospital. I doubt if you'll find it in a level 4 hospital. But if you go to any level 5 hospital, if you may end up finding it or be directed where you can find it.
It's available in the county level hospitals, and even in the national level hospitals. So it means that in a common dispensary in that community, if they want a HPV vaccine, they will have to be referred to the next health facility at a higher level, in the higher tertiary. Yeah.
So what must be done to ensure that more girls show up to take the HPV vaccine?
There's already public awareness. Maybe we need to give it more power and energy so that the message is clear about the importance of the vaccination. We need to educate our masses on the importance of prevention of any disease, not only CS cervix, prevention of all preventable diseases. So health education, empowerment of women, and also addressing the misperceptions or misinformation about the vaccine. And lastly, also I think the cost. If we can find a way of making the HPV vaccine be free, like the other vaccines. You see like the example, the vaccine for TB, the beta ACG, polio. I mean, they are free. They're offered free. So if we can find a way of incorporating them in KP and make them free, it will go a long way in improving the uptake of the HPV vaccine.
Let's educate the masses frequently. The same way the HIV virus and AIDS prevention was educated on the masses, such that it's even part of the curriculum of the education system. The students are learning it in school. It's something that we were introduced to from the beginning. The information also needs to reach the parents, the people, the guardians they are staying with. So the information should be made available at all costs, at any time, without discrimination. According to me, the HPV vaccine is very safe. I'm yet to encounter side effects with the vaccine.
And if you allow me to digress, you know what the COVID vaccines, the role they played during the COVID pandemic. If we went for the vaccine, maybe we will be still in the lockdown. So the HPV vaccine is safe, as much as people have tried to fight it. It has shown to be not only effective, but also efficient in preventing cervical cancer.
To the parents out there, I would say I would advise them to take their children. It's painless and it is cost-free, and prevention is better than cure. So for me, I've experienced it. I would love them to take their children so that they don't experience the same thing I did, losing a loved one. It is very painful, and
The hesitancy to uptake the vaccine is a major concern in Kenya. Stakeholders should therefore have a uniform approach in addressing the issue to boost the overall public confidence. More advocacy strategies should be developed to counter misinformation, and more channels created to spread facts on the safety and importance of the HPV vaccine.